Hey there, I'm Claudia Petrilli, functional health coach, women's wellness advocate, health educator, and the creator of the Hormone Rescue program. So I wanted to talk to you briefly today about how hormonal birth control can affect your libido. One of the many complaints I hear from women in their 30s and 40s is that they have lost desire or interest in sex. They have a hard time getting aroused or properly lubricated, which of course is going to create vaginal dryness and in turn can cause painful intercourse. And some women have an inability or just a hard time climaxing, and that is no fun. Sex should be fun. It's very beneficial to our health. I want you to know that there is hope and you don't have to just live with it. So there's lots of reasons why you may be experiencing these symptoms, and I'm going to actually be covering them in a free masterclass on September 21st at 7 p.m. EST. We'll be talking about things like age, of course, lifestyle, stress, diet, and so on. So just look below this video for some details on that. But what I wanted to specifically talk about in this video is about hormonal birth control. Because it's something that so many women are on, and they don't often realize that could be affecting their libido as well as other things with their health. I personally was on it for 13 years. I understand it can be really convenient, and sometimes it is a solution for some people, but it's not the only solution. And what I have seen time and time again over nearly a decade of doing this work is that women aren't typically being educated about the side effects, right? Whether they're short-term or long-term. And I strongly believe in informed consent. When you are informed, you can make better decisions when it comes to your health. So some things that occur that I experience myself as well as what I see with clients is things like leaky gut, imbalanced gut bacteria or dysbiosis, nutrient deficiencies, mineral imbalances, things like that. A lot of women will experience anxiety, low mood, depression, suicidal thoughts, unfortunately, and some women will have trouble conceiving once they've come off of the pill or some sort of hormonal birth control, and oftentimes they may even experience miscarriages. But the purpose of this video is to talk about libido, and that's also another side effect that a lot of women experience. And the reason why some of these things happen is because hormonal birth control is going to suppress your brain from releasing necessary hormones, right? So that's going to suppress your body from ovulating. Now, combined oral contraceptives specifically are going to increase your SHBG, your sex hormone binding globulin. And the reason for that is it protects your body from the excess estrogen in these hormonal contraceptives. And then what happens as a result is that can reduce your levels of androgens, specifically testosterone, and that of course will affect your libido and your arousal and desire for sex. So unfortunately, it's not always just temporary. Some women experience it while they're on hormonal birth control, but some women will experience that even once they've come off of it, so long-term effects, and that is just not fun for anyone. But there are things that you can do to resolve that, but it does take some work. So I'm going to be talking a lot about this during my upcoming masterclass, but just to leave you with something for right now, if you're somebody who's been thinking of maybe coming off of hormonal birth control, or you're just not sure what other options there are non-hormonal options like fertility awareness method or FAM. It's also called natural family planning. I like that because it really helps you to better understand your body, get to know the different phases of your cycle. There's different ways of doing that. So typically it's measuring your body temperature, checking out your cervical mucus and kind of paying attention to that, as well as your cervical or your cervix position. And there are some apps and thermometers and things that can help guide you along with this. There's a lot of options nowadays, like the Daisy Fertility, Temp Drop is another one, Natural Cycles, I believe. So do some research on that just to familiarize yourself and really get educated on how to move forward if you wanted to go that route. Obviously, there's some other things that have stood the test of time, like male or female condoms, diaphragm, cervical caps, sponges. The copper IUD is another option as it's non-hormonal. but that does present with its own side effects for some women. So definitely want to do some research on that. There are some other things, of course, as well. And these are all options that I educate my clients on, but I will be talking more about them in my upcoming masterclass. So like I said, make sure you look below this video or head to the link that's in my bio to sign up for that. It's September 21st at 7 p.m. EST. We do have limited spots. It's free, but if you want to get access to it, just make sure you sign up and save your spot. All right, thanks for listening. If you have any questions, just post them below the video.